Good evening, everyone. I'm Dr. Michael Duarte, RCMA's immediate past president. Thank you for joining us for tonight's presentation. Regardless of whether you're a resident transitioning into practice, a new physician, or seasoned physician, it is vital for us to understand professional liability insurance. I want to thank RCMA's business partner, ProAssurance, for presenting this evening and sharing what we need to know. It's my pleasure to introduce today's presenter, who's Lucy Sam. She is the Regional Vice President of Underwriting for RCMA's professional liability business partner, ProAssurance. Lucy has over 2 decades of work experience in the insurance industry. She started her career at NorCal Group in 1999 before transitioning to her current role as Vice President of Underwriting at ProAssurance. So welcome, Lucy. The floor is yours.
Thank you for inviting me to this evening event. I'm here to talk about general trends in the medical and legal environment, as well as provide an overview of the medical professional liability space. This is my agenda for the evening. And I'm just going to start right away. This map represents what is going on across the nation with regard to tort reform. As you can see, it is a map that reflects the fact that tort reform is handled on a state-by-state basis. It's not a national endeavor, and each state has different things going on. There are currently 29 states that have some tort reform in place. And the one issue that you generally see is some sort of cap on non-economic damages, but there certainly may be other components involved in the tort reform. So what is a tort? A tort is an act or omission that causes some sort of harm. And from a legal perspective, it's a civil wrong where a court can apply some sort of liability. Tort reform is legislative efforts to change and impact the ability for victims to file lawsuits, as well as limit the recoveries. With respect to our space, the medical professional liability space, what tort reform does is it reduces the number of frivolous cases that involve our practitioners. They're generally speaking caps on damages, and non-economic damages is generally the one that you see. And given this environment, insurance companies have the ability to charge lower rates because there's a level of predictability with regard to how much we expect from an actuarial perspective for losses to be based on different components with regard to the practices involved with our insureds. In California, our tort reform is known as MICRA, and that was originally instituted back in 1975. There had been no changes to MICRA in 48 years. So that non-economic damage cap at $250,000 stood for that long. There had been attempts to change things, but that did not come to fruition until January of this year. And I want to walk you through what the changes are. So I had mentioned that there was a non-economic damage cap that had been at $250,000. Well, there are 2 caps now. The introduction of wrongful death is a new cap that is available, and it increased from $250,000 to $500,000. It's going to increase $50,000 annually for 10 years, and then it will have a 2% increase annually for inflation. That is wrongful death. If there is a situation where there's not wrongful death involved, the cap goes from $250,000 to $350,000, and then similarly there will be increases annually with regard to where this cap is going. Another change is there are 3 separate categories of defendants. Previously, there wasn't. So there is a healthcare provider, and those are physicians, nurses, PAs, etc. Healthcare institutions, hospitals, unaffiliated healthcare institution. This is a new category, and it's a bit ambiguous, but we anticipate that this would include ambulance services or the like. Case law will certainly help determine what that means, but that has been a new defendant that's been defined. There were been other adjustments with regard to legal fees, but I thought I wanted to point out that there are protections with regard to expressions of sympathy or regret or faults that healthcare providers may make to patients and or their families. So I thought that was an interesting one, and that would be helpful for you as a practitioner. Some other things that are happening, social inflation, you may be hearing a lot about this. In our world, or in the MPL space, it's about multi-million-dollar verdicts, and we are certainly seeing more of them. And it's just interesting because jurors are angry, they're questioning science, they may have anti-corporate attitudes, they're questioning how healthcare is delivered, and they're very comfortable awarding large sums when we have verdicts. And when I say we, I don't necessarily mean ProAssurance. It's just being seen, across the U.S. This graph is an interesting one because it shows how the verdicts have been mapping over time. You see them at the 10, 25, and 50 million level. And there's a dip in 2020, and that's attributable to COVID and the fact that the courts were closed for quite some time. But you can see there's been a sharp rise since then, and that is it's something for insurance companies to watch. So I also wanted to talk about other things that we're seeing with regard to the evolution of healthcare. We continue to see the consolidation of practices, groups getting larger, small groups joining. Certainly there's strength in numbers there, and we're seeing a lot of consolidation. About 75% of physicians now are working with large medical groups or hospital systems, or even in private equity situations. And private equity is a whole other situation that is quite interesting. They're very interested thus far in specific medical specialties. There's been a lot of activity, private equity purchasing practices in urology, ophthalmology, cardiology, oncology, radiology, and orthopedics. And their focus is on creating efficiencies and certainly profit. And generally speaking, they're probably looking to sell practices within a certain number of years. So that's a different component to medicine, but it's something to be cognizant of. Telemedicine has been around for quite some time, but certainly during COVID grew exponentially and is changing how medicine is delivered. And retail medicine is clinics that are being opened up in supermarkets and big stores and Targets, Walgreens, and there are pros and cons. They're certainly offering access, making it easier for folks to get care. And there's a potential downside where if a patient doesn't have a primary care physician who's going to oversee kind of a bigger picture situation. So these are all different elements of what is changing and evolving throughout the healthcare space. So now I want to discuss MPL, medical professional liability basics. So there are 2 types of policy coverages available. And I'll start with occurrence, but just know that that's generally not available. It's just a good thing for you to know. I'll need you to focus on claims made, which I'll handle in a moment. An occurrence policy, the premium is generally higher, and the policy provides coverage for incidents that happen during your policy period, regardless of when the claim is reported. So you can report claims years later. So that's why the premium is higher up front. Claims made coverage is what you will see in the medical professional liability space. And that is less premium than occurrence coverage initially. It's a sort of pay as you go, and it includes a retroactive date. The retroactive date is the first date that the coverage will be available. And generally speaking, what happens with claims made coverage is in your first year, your premium is relatively low because there is not much expectation that you'll be reporting a claim in that first year. You will see gradual increases in premium over a period of generally 5 years, and it should stabilize at the 5th year. You can report claims for incidents that occurred on or after your retroactive date throughout your policy term. So I will talk about that a little bit more, but that's the focus. That should be the coverage that you understand. So your premium will be based on multiple factors: your medical specialty, where you're practicing, what state, what county, limits of liability, higher limits, lower limits, and then what is your practice environment? Are you in a group setting? Who are your associates? Are there nurse practitioners, PAs, etc.? Those will all come into play as the premium is being developed. Now, reporting endorsement coverage. If you only remember one thing tonight, this is the item I would suggest you remember. As I mentioned, claims made coverage is generally speaking what you will encounter in the medical professional liability space. And as you recall, it has a retroactive date, and then there's going to be a coverage period. When you cancel your coverage because you're leaving the group, you're leaving the state, you're retiring, well, maybe not retiring, but you're essentially leaving, you want to make sure that you have the ability to report claims for incidents that occurred during your active policy period. So you want to have coverage from your retroactive date to your cancellation date. That means that you can handle that in 2 ways. One is purchase what's called reporting endorsement coverage, also known as TAIL, from your carrier from whom you're canceling your coverage. That costs additional premium, and it's important for you to know if you're negotiating your contracts or wherever you're going to be working, it is very important for you to know who's going to be responsible for paying that premium. It is a larger premium, and generally speaking, you've got 30 days to pay the entire amount, whatever that is. The other option is to purchase what's called prior acts coverage from your next carrier. And that means that your next carrier is going to start coverage and match your retroactive date from your prior carrier. That way you can report claims to the second carrier that you go to. Either way is important, but definitely know that that is something that you will need to understand as you embark upon your practice and when you terminate your coverage. That's a key thing to understand. Finally, I want to talk about the fact that you have access to an insurance company in different distribution methods. We have clients who access the company on a direct basis, where they come to us and say, I want to purchase coverage, and we work directly with the insured. The other method is to go through a broker, and they're insurance specialists that you appoint to represent your interest, and we have a contract with them, and they negotiate your terms for your coverage with the company, and they receive a commission from the carrier. Next, I want to talk about claims. This is what you're buying coverage for. So, and you will get sued as part of your profession. And I got that from our claims person because I asked for some assistance with slides, and I thought, boy, do we really want to say that? And she says, yes, absolutely, we should. But also wanted to provide reassurances that the insurance company is on your side, and they're there to protect your interests and help you navigate the process. It can be very daunting for individuals who go through this experience for the first time or the second time, and we're here to support you. And we also have risk management specialists who can assist with regard to how to mitigate situations so that we don't create liability in our practices. So this is an interesting graph, and it's from the AMA, and essentially the question is, who's been sued? Who's been involved in a claim? And the graph sort of speaks for itself. Certainly, surgical specialists they have a higher percentage, but if you look in the middle, it says about 30% of physicians have been involved in a claim. And this was just a survey that was done between 2020 and 2022. So what happens when you are involved in a suit? Your insurance company will assign a defense team and an attorney. And the defense team will be a claims specialist who will be your contact throughout the investigation. And essentially, they will be there to guide you and help understand what the situation is and how to best navigate through the situation and come to some closure of the case. The important thing is certainly to cooperate with the attorney and with your insurance companies to get the best possible outcome. I also mentioned risk management, and in our space, we call the risk management consultants our social workers because they are just wonderful individuals. They are all about helping our insureds. They want to share their knowledge with regard to best practices, changes in laws, and their objective is just to help. They want to help educate, and they want to help you avoid creating any liability. They have many tools that are available. There are different assessments. We have online assessments to do questionnaires. They can come to your practice if you have specific areas that you want for them to review. And they're really there to help, and they want to identify any gaps, anything that can help you enhance your practice setting. The most common areas that we see issues in are the following, and these are some best practices that they like to assist with. Documentation, just to be thorough and objective. And I don't need to go into all the specifics because you probably know better than I, but what I will say is your medical record is the first step. If you're involved in a suit, that medical record will be subpoenaed, and they'll want to look at how thorough the documentation was. Does it reflect the real care that was provided? And there's metadata that's available because they'll see when did you document the file, and how long were you looking at test results or whatever the information is. That's not just what's in there, but it's also the metadata. They'll see exactly what's happening. The other area where we've seen claims is confidentiality. There's a lot of best practices involved with just ensuring that patients' information is not inadvertently shared, just speaking in the hallways, or making sure that No one else is looking at medical records that shouldn't be. Again, that metadata is available. Communication. This is an interesting one because it's not just communication with patients and their families, and obviously wanting to make sure that they're kept in the loop of what's going on with the care. But a high risk area that we've seen claims has to do with transition between providers. You're a hospitalist and your shift's over. Who's responsible for what? Who ordered what test? Who's going to be following up to it to make sure the test was completed? There's a lot of potential exposure in these situations, and our risk management specialists can assist in ensuring that you create a situation that mitigates liability. So then choosing the right carrier, there's some basics. It's not like, you should probably talk to your colleagues and talk to your colleagues with respect to their experiences with carriers. One of the things that's extremely important is to check the financial strength of your carrier. What is their AM Best rating? How do their financials look? Are they going to be around for the long term? Because ultimately you want them to be well funded so that they're available to pay claims. Underwriting philosophy, that's my world. And that's really about understanding your practice of medicine. Are they providing the appropriate coverage for your practice? Do they even understand what your practice is? Are they responsive to your needs? What's their customer service expectation and standards? Those are going to be really important as you communicate with your carrier, because you want an underwriting team that understands you and wants to help. Claims handling. Are they defense oriented? How are they going to handle situations? Are they there to protect your reputation? How will they handle frivolous suits? And then finally, risk management. That is what we've just discussed. What kind of educational opportunities are available? How can they help me? Are they available 24/7? Because that's a huge service. We get lots of calls, and it's really interesting because most of the calls that our risk management specialists receive have to do with clinical issues, consent, documentation, tracking results, and follow-up. These are the most common questions we receive, and we have many specialists of different backgrounds. We have attorneys, we have clinicians, we have administrators that are all part of our team. And then finally, the support of organized medicine. We're here, I'm a legacy NorCal person, and I'm with ProAssurance now, and we certainly understand the importance of organized medicine and where do we fit with regard to supporting that. These are elements that you should consider as you look to pick your carrier. So that's all I have. And I don't know if there are any questions.
So actually, Lucy, I had a question
Yes.
related to graduate medical education and with residence and malpractice. So I don't know if you have a lot of background in that, but I get a lot of questions from physicians who teach residents and medical students as well, asking if they need anything extra for their malpractice. My understanding and experience for residents is that residents are physicians that carry their own malpractice, so they're covered. There's nothing an attending physician needs extra, but wanted to see what your thoughts were, and also related to medical students at all.
So with residency programs, it's interesting. That's an exposure that professional liability carriers can provide coverage for actual residency programs. We've had some of those that are associated with some teaching facility, and they're looking for coverage for the residency program and the residents. So that's something that is available. And if one is a resident, you should look into that, because even if you're in training, there can be allegations of, a tort. As I said, it's the act or omission that's caused harm. So residents will want to make sure that they have coverage. And generally speaking, there should be coverage for the residency program. And then for the teaching physicians who are part of that, I always suggest the first stop be with the residency program to see if that extends to the physicians. And if it does, great. If it does, I would suggest those physicians advise their own professional liability carrier of this activity, so that we make sure there's an exclusion, so there's no misunderstanding as to the source of coverage. And if the residency program does not pick up coverage for those teaching physicians, that's also when you should contact your individual professional liability carrier to let them know of your activities. Can you address how an MPLI company can be organized and that impacts their desire to settle? That's a great question. I don't know if it's necessarily how how a company is organized. I think those are questions that have to do with their specific claims handling philosophy. And those are real important because, that is should be some of the questions taken into consideration when the selection process is being made. Being defense oriented and understanding that you want your reputation to be protected is very important. It should be important to all of our insureds. So that question should be one that is posed as you are looking to purchase your coverage. It's interesting having come from a mutual company, which NorCal was, and now being acquired by ProAssurance. The defense orientation has not changed at all between the different organizations. It's just as strong. So I don't know that it necessarily has to do with how the company's organized. It's more about what is their philosophy and approach. And I think those are the questions that should be asked.
Lucy, we want to thank you so much. And we want to thank those who have attended.